We are now live. Good afternoon, everyone. I am Dr. Nagaraj Maka from IIP Digital Media Team. We host for today's webinar on Menopause, the Change Challenge with resource person Dr. Shailaja Patel, being organized by IIP Women's Health Gujarat State. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since 1955. The IAP digital media team consists of a group of physios who handle Zoom platform, webinar live streaming, and IAP profiles on social media platforms like Facebook, Instagram, Twitter, LinkedIn, YouTube, and so on. Follow events such as webinars, workshops, CMEs, conferences, health camps, blood donation, drive, and to know about recent updates on physiotherapy. Subscribe to IIP YouTube channel for notification of our live webinars in playlist session of this channel. Webinars are segregated into various folders on topics like orthopedics, neurology, sports and fitness, pediatrics, cardiopulmonary and women's health, research, cancer rehab, etc. For easy access, the social media links will be shared in shortly. So without much wasting our time, I'll hand over the session to the today's moderator, Dr. Shweta. Ma'am, over to you.
Thank you so much, sir. Myself, Dr. Shweta Parikh, an associate professor at KM Patel Institute of Bhaikaka University. I am having 17 years of experience in areas of academic research and clinic, and I'm a joint coordinator of the IIP Women's Health Gujarat. I'm glad to have you all people by putting faith in IAPWC, by putting faith in speaker and us. So, first of all, I would like to congratulate which that is the major role of the physiotherapist, and that is also on occasion of the World Physiotherapy Day. So I would like to thank all of you. Now, our today's session moderator is Dr. Jasprit Kaur Kang, madam. She is the principal at KD Patel Institute of Physiotherapy, is an accomplished professional in the field of physiotherapy with specialization in neurology and holding a PhD from Gujarat University, Ahmedabad. With a foundation as a lecturer and subsequent role as a principal at distinguished institution, she has spearheaded academic initiatives, guided impactful research, and steered the comprehensive functioning of prominent physiotherapy colleges. Dr. Kang's expertise transcends traditional academic role as evidenced by her active participation in presenting papers, posters at national and international conferences. She has received Spinal Cord Society Gold Medal Award for her groundbreaking paper on rehabilitation management at ECCON 2006 conference, among the several other notable presentations and publications. Her profound commitment to the field shines through her extensive involvement as an organizing member, convener, and chairperson in numerous conferences, symposiums. Additionally, Madam's role as a judge, speaker, and office bearer for IAP and IAP Women's Cell has garnered her recognition, including esteemed title of Inspiring Leader in Physiotherapy. Madam's interests span across education, training, policy making, and specialized domains within neurology, encompassing both adult and pediatric population as well as geriatric. Visionary leadership make her an inspiring and influential figure in the field of physiotherapy. I welcome Dr. Jasprit Madam, and we are really glad, Madam, to be a part of IAPWC Gujarat Cell that we have organized such event on this occasion. So now I hand it over to Jasprit Madam.
Thank you, Dr. Shweta. It was a long introduction. Well, thank you so much. IAPWC Gujarat welcomes everyone on this platform, and we're looking forward for many more like this so that we can illuminate and definitely motivate our students for a better work in their field, in their profession. Now, not taking much time, we'll move forward to our today's speaker. She's Dr. Shailaja Patel, who's MPT in cardiopulmonary and ICU, a gold medalist from Sardar Patel University. She is pursuing her PhD from Bhaikaka University, Karamsad. She's also a BLS trainer, Pilates trainers, aerobic instructor, pelvic floor muscle specialist, Garbhasha expert. She has been rewarded with the best paper presentation from Parul University. She is also awarded best paper presentation in Charusar. She has given more than 7 to 8 expert talks in gynecological hospital, JC Club, Rotary Club, more than 110 schools and colleges at various city. Also, more than 25 Gujarati articles have been published in various newspapers like Divya Bhaskar, Gujarat Samachar, etc. on different health-related conditions and its management, which includes different conditions like diabetes, hypertension, thyroid, pregnancy, etc. She's also done many seminars for middle-aged women for breast cancer awareness, physical fitness, prenatal, postnatal, menstrual hygiene. She's also been awarded by JCI Club Vallabh Vidyanagar in 2023 as a silent worker from Anand Zone. We welcome you today, madam, and we hope that everybody today gets a better insight about menopause. I think which is a very, very important topic which basically touches the female life at one or the other end, not because it gives a lot of changes in the body, and eventually there's so many others who need to help her during this transient phase. So you can begin. Thank you so much for being with us. I hand over to Dr. Shelja.
Thank you very much, ma'am. A kind word from you and Shweta, ma'am. Thank you very much. First of all, thank you very much to IAP Women's Cells. Thank you very much. Shweta madam, Hita madam, Jaspreet ma'am, thank you very much for giving me opportunity to and have a faith on me, right? So I'm not wasting much time, and we will start with the topic, that is menopause, the change challenge, right? So as you know, what is menopause? So menopause is the years of amenorrhea more than 12 consecutive months. But before knowing what is menopause, what are the signs and symptoms, we should understand what is the importance of menstrual cycles. What are the facts related to menstrual cycle? So we'll just quick review about that. So in India, if we think that previously the life expectancy of a female is around 62 years. But as the advancement is there, as the technology advanced, okay, the female's life expectancy is increased from 62 years to 69 years. So there is a major impact, major increase in life expectancy of female, right? Now, on average, if we are talking about menstruation cycle, in living years, 7 years consecutively, this female have menstruation cycle, right? Menstruation cycle is important for a girl to become a mother, right? So it is important transition from the girls to a womanhood, where a girl's child first have a menses period, which is termed as menarche. Okay, so there will be very much support from the family. There is very much support from the fans. Second important thing is we can have minimal of 150 periods per lifespan to 450 to 500 periods in our life, right? So as I told you that life expectancy of female is increased, but we are overburdened with abnormal lifestyle, right? Diet problems, physical inactivity, and that make a female more vulnerable to have an early menarche. So previously, where a girl is become menarche, first menstruating at age of 14 to 16 years, now that has been reduced to 11 to 12 years. And in some girls also, it is 9 years. So it is very much early. A girl conceiving, not conceiving, the girls become menstruating, right? So as early as the menarche, there are the chances of early menopause, because now your ovarian follicles are depleting. They will go to the atresia, so they will be vanished. So the fertility window will be very much less. Along with that, we are occupying by the lifestyle disorder. So average starting age for the period has been changed, as I have told you. We are born with a certain number of eggs in our bodies or ovaries, even before the birth, right? Before we birth, that is predetermined that this girl will have X number of eggs. So that is only the fertile window. That much time, or once that ovums, that eggs has been used, then there is no way to be a fertile or to be a pregnant. So at birth, around number of oocyte is around 1 to 2 million. So as the girl reach to the puberty, which is around 4 lakhs, and even at the age of 30 to 35, that is 1 lakh. So now, jitna kam, the number of oocyte is very less, right? So what will happen? Ovarian reserve will be less. So at the same time, in normal individual, in normal menses cycle, at a time from ovaries, 11 to 12 or 12 to 14 follicles become mature. And out of that, one dormant or dominant follicles will mature and it will be released, which is termed as ovulation. But you are having less and less ovarian reserves. What will happen? In one cycle, when a normal female have 12 to 11 to 12 normal Graafian follicle which gets matured during each cycle, now that number has been reduced. Why? Because total ovarian follicles or Graafian follicles has been reduced. Now, if you don't know, your brain is affected by periods and vice versa. Your period will be affected by your brain. One rare disorder of the eyes of menstruation cycle, which is termed as viscerous menstruation, that is bleeding from your eyes. Okay, so that is a type of endometriosis. So endometriosis are everywhere. Sometimes what will happen from uterus, they will reach to the certain part of your body, and then it will be influenced by the progesterone and estrogen, which is released into your body. So this is a rare disorder, although it accounts for 1 to 2%, but there is a disorder where a woman is menstruating from the eyes. The many research has been said that sleeping with a night light will regulate your menses cycle. So if you are suffering from polymenorrhea or oligomenorrhea, the duration of cycle can be maintained if a female is starting 100 watt of bulb when she sleeps, right? We think that, oh, that much of we bleed during the menstruation cycle. But it is not more than 20 to 40 ml in 7 days. But it looks like more. Why? Because it is contained with some secretory fibers, some dead dermis, and many things of that. But we are only using maximal to maximal 60 to 70 ml in normal menstruation cycle, right? And if you don't know, then the studies had says that whenever the female is menstruating during the menstruation cycle, they spend more money, right? So be watchful whatever you are shopping and at what window duration. So now we much talk about the facts regarding menstruation cycle. So right now we'll focus on what is the estrogen level. Why it is important for us to know the role of estrogen level, right? Because see, menopause will lead to decline in ovarian follicle, and ovarian follicle will releases estrogen. So if you achieve menopause, what will happen? Your estrogen level comes down. So before that, knowing what are the sign and symptom, what is the pathology of menopause, we have to understand what is the role of estrogen. We are not going into detail of it. This is just a brief view. What is the role of estrogen? So except the reproductive organ maturation, it will control your body. Why? Because estrogen will help to what we say digestion of your lipid, so that you won't be overweight whenever the normal amount of estrogen is secreting in your body. Second thing is, if there will be reduction in your estrogen, it will reduce your basal metabolic rate. So even though you will eat less, the higher chances of getting obese. Okay. The other role is that it will be have a fat metabolism. As I have told you, it will digest a lipid, or it will store a lipid in a reproductive area, around the reproductive area, which is a normal pattern for female. That is a pear-shaped obesity, what we term it. It is a responsible strengthening of bone. Now you have a question, how a estrogen can have a role in strengthening of the bone. So in presence of estrogen, your osteoclast activity has been kept inhibited, right? So what is the role of osteoclast? Osteoclast will responsible for bone resorption. Okay, so there will be a bone porosity or osteopenia and osteoporosis of your bone. So if there will be normal amount of estrogen in your body, it keeps osteoclastic activity inhibited, so there would be a bone resorption. Third thing, it will improve the skin texture. It will have an impact in your emotional behavior. In presence of estrogen, even melatonin will be released, which will normalize your sleep cycle. Along with it will give a peaceful sleep. It will lead to development of breast, maturation of the reproductive organ. So these are just the role of the estrogen level. Now we have seen that if we are talking about a female and male whose age is same, like 45, 45, whose chances of heart attacks are more. So commonly we say male are more prone to develop cardiac heart attack compared to the female. So yes, it is. But why female after menopause have a fatal cardiac attack? Because now estrogen is not working properly. There is a depletion of estrogen. Insulin sensitivity has been reduced. Lipid metabolism is affected. There will be a visceral fat deposition, certain enzyme which will increase in your body. Along with that, there will be a problem in liver metabolism. And this collectively will lead to fatal heart attack in a female. So first time heart attack or first heart attack in female is so much fatal than the heart attack compared to the male, right? So these are the simple study. This is just study and statistical data which suggests that there are the chances a female having heart attack, 11.8% women can die compared to male after the menopause, right? This is after the menopause, because before menopause, there is normal amount or optimal amount of estrogen, which will normalize or it will have a cardioprotective effect. After 5 years of heart attack, 32% die within 5 years post-menopausal female compared to 16.9. And mass within 5 years, that is major adverse cardiac event, will be very much prominent in female, that is 30.2%, whereas in male it is 19.8%. So now we exactly come to the point, what is the definition of menopause? So as I have told you, menopause is the 12 month of amenorrhea. Amenorrhea means absence of menstruation cycle. Now, for menopause, there is no need to go for any kind of hormonal checking because it is a retrospective diagnosis, right? Once a female will say, I am having 12 absence menstruation cycle, then simply she is known case of menopause. Why it is occur? Because of depletion of the ovarian follicles, or because ovarian follicles are less, there will be diminution or less secretion of the ovarian hormone. So there is no independent biological factor marker which is necessary to rule out your osteoporosis. So objective sensitivity marker is irregular cycle, right? There are certain another definition. What do you mean by premenopause? So premenopause is a period, reproductive period prior to your menopause, where the female can still become pregnant. So this is a window opportunity for a female to have pregnant. Even it says that now the ovarian follicle has been depleted, so there are less chances. But here we have to be taken a proper, what we say, contraception, because here there are highest chances to get a pregnant for a female, because now hormones are fluctuating and we don't know, and we don't have known LMP, menstruation date. So at that time, we don't know where there will be ovulation. So here there are the highest chances of a female to have a pregnancy. Second is perimenopausal period, that is 3.3 to 5 years before and 1 year after the menopause. And which is perimenopause and menopausal transition is same. That is where you found there will be endocrinological problems or changes, hormonal fluctuation, and there will be disturbed menstruation cycle, right? What is post-menopause? So it is a lifespan of a time which is dating from final menstruation period, regardless whether menopause was spontaneous or iatrogenic. And one another terminology which is termed as senescence, that is a post-menopausal female, if she will live till 60 years. So after 60 years, this period of post-menopause is termed as senescence, right? So now we'll just quickly revise. We will quickly see what is a normal menopausal age in India. See, menopause is not just only the absence of menstruation. That is huge or dramatic change in your human body. So that will not only lose the fertility, it will not only decrease your fertility, but it will increase a risk of various midlife disorder, which could be preventable, right? So in India, the menopausal age is very much less compared to the Western country. So we can say that Indian women have less fertile compared to the counterpart of the Western country. So many perimenopausal age in India is around 44 to 45 years, and postmenopausal or menopausal age, we can say it is 45 to 45 years plus or minus 5 years, right? So now there are classification of menopause. So there are two types of menopause. One menopause which is termed as natural menopause, and second which is termed as induced menopause. So as the name suggests, natural menopause means there is a decrease in ovarian failure. There will be decrease in ovarian function. There is a depletion of the Graafian follicles and ovum. You don't have now ovum in your ovaries. So over a period of time, you will stop menstruating, right? So median age will be around 50 1 year, where there will be a follicular depletion, and because of that, the estradiol level in your bloodstream will be reduced. Now, there are two categories in natural menopause. One which is termed as late menopause, and second is premature menopause. So, if a female is naturally menopausing after age of 55, so till 55, she have her periods. So that is late menopause. And premature means before age of 40, whether if it is a natural menopause, then it is termed as premature menopause. So this is about the natural menopause. Second is termed as induced menopause. So in certain condition, like they have some fibroid formation, they will have some blockage of the tubes, they will have a ovarian dysfunction. So at that time, they will remove the ovary, which is termed as bilateral oophorectomy, where a female won't have its menstruation cycle. Second is ablation of ovarian function in case of pelvic irradiation. Many times, if a female having uterine cancer, cancer of cervix, and any other surgery, so because of chemotherapy, they have to ablate that, right? So that's why they will have menopause. And last is medical menopause, which is termed when a female is put on agonist of GnRH, long-acting GnRH, that is gonadotropic releasing hormone, right? So that can also lead to menopause. So these are the two categories. I hope you get it. One is natural menopause and second is induced menopause. Now, what are the stage of menopause? So here I will just keep this slide. This you can see is total 10 category of this are there, right? So stage 1 is -4, -5, -4, -3b, -3a, -2, and -1. And on the other side, it is +1a, +1b, +1c, and 2d, right? So this is a 10-point grading system, which is the female reproductive aging. These are the stage of female reproductive age. So in the y-axis, you can see the terminology. So till -5 to -3a, right? That is a reproductive phase of the female cycle. So when a girl have first menses, which is menarche, that comes under -5 category. Over a period of time, when the age is increasing, she had -4, -3b till the age of 35 to 40 years. Then it comes a period which is -2 to -1, where there will be a menopausal transition. And after completion, that is when a first time females stop menstruating, right? After age of 45, that is the first menstruation period stoppage, which is termed as grade 0. So grade 0 is where you are starting menopause. Minus means you are in reproductive phase, and plus means postmenopausal period, right? So during the reproductive phase, as your age is increasing, your follicular stimulating hormone, your estrogen level will be increasing, right? Your antrum follicular count. You know what is antrum follicular count? These are the total numbers, not total numbers, these are the number of the Graafian follicles which are matured in each cycle, that can be checked by transvaginal sonography post 3rd day of menstruation cycle. So during that ultrasound sonography, you come to know at the same time, at the same window period, how much number of a Graafian follicle has been mature. So that suggested your ovarian function, right? So if you are having more antral follicular count, that means your fertility is more. Same way, that will secrete some hormone, that is anti-Mullerian hormone. So if it is high, then that means your fertility is high. So certain biomedical markers are that which will say you that female is reproductively okay, so her fertile capacity will be good. So one is anti-Mullerian hormone, second is follicular stimulating hormone, inhibin B, and along with that antral follicular count. Now, as there will be, as the person go from the reproductive stage to the menopausal transition, now what will happen? We have X number fixed. Say, for example, 4,000 number of ovum at the age of 20 years. So now every cycle they are used, and there is no production of the ovum because it is predetermined, and you are giving a fixed number of ovum. So at that time, what will happen? Day by day, there will be a ovarian depletion, and that will lead to early exhaustion and early exhaustion of the oocyte, early exhaustion of ovum, and that will lead to menopause, right? So this is just a grading system. So I hope you are clear with this. Now we'll see the pathology. What is the pathology of menopause? Already we have discussed there will be ovarian failure. So because of ovarian failure, the number of ovarian follicles are decreased. So obviously, if number of ovarian follicles are decreased, there will be inovulation. Matlab, there is no ovulation, and that will lead to infertility. That is the first sign. Second, because of inovulation, your progesterone level is reduced. Now, why your progesterone level is reduced? Because once there will be a mature Graafian follicles. So at the day of ovulation, what will happen? The ovum will be released into the fallopian tube, and then it will be goes into your uterus, right? And the material which is still there, that will be shrink, and that will make a corpus luteum. Now, what is the function of corpus luteum? It will prepare for the pregnancy. It will release progesterone, which will support the pregnancy. So now, if there will be inovulation, means there will be no inovulation, there is no creation of corpus luteum, and thereby there is a reduction in your progesterone level, and that will be responsible for amenorrhea. On the other hand, third hand, you can see as your ovum are not producing estrogen because now it is not matured, it is not ovulating, right? So what will happen? There is a depletion of the estrogen. Now, what is the role of estrogen in your vagina and sexual organ? Free environment was free from any kind of bacteria. But now, because estrogen is less, the epithelium cells are very much less, so the pH will be increased, right? So what will happen? Which is the natural protection, which is come from the acidic environment of your vagina, will be inhibited. So there will be vaginal atrophy. There will be a chances of repeated senile atrophic vaginitis. So women who achieved menopause have higher chances of development of bacterial infection vaginitis. Along with that, they will have highest chances of HPV infection, which will be responsible for the cervical cancer. Third thing which I have told you is estrogen is responsible for inhibition of osteoclastic activity. Now there will be depletion of estrogen. So what will happen? The osteoclastic activity will be doubled. So there will be a bone resorption, which will lead to a chances of osteoporosis. Along with that, what will happen? A patient have loss of libido, especially the female who enter into the middle life or older life. They will have a less of sexual desire. So one hormone which is responsible for it is androgens, right? Androgens is the secreted by the theca cells of the Graafian follicles, right? Then it will be converted into estrogen and many other. Whenever there will be less of estrogen level, there is a less of sexual desire, which is termed as less in libido. Now you commonly account that, you commonly know, out of 100 postmenopausal female, 70 to 80 female have hot flashes, right? So this is the most and drastic and classical features of your menopause, that a female have vasomotor symptoms. What is vasomotor symptoms? Such as hot flashes. Now what is hot flashes? That are the episode of perspiration, that are the episode of flushing of mouth, that is the episode of producing the heat from the face and neck, which may lead to anxiety, and it will reduce your quality of life. Now, why this has been happened? Because you know the menses cycle have two phases. One is luteal phase and second is follicular phase. So after the inovulation, when luteal phase is there, right, luteinizing hormone is on its peak. And then after it is in peak, then it will be give negative feedback to your anterior pituitary gland, so that luteinizing urge will be reduced. Now, because there will be inovulation, there will be no negative feedback to your pituitary gland, and that will lead to increase a drastic amount of your luteinizing hormone, which is responsible for vasomotor symptoms. One more important thing, you may have seen that many females have an infertility problem. So that can be treated by the urine, the extraction of the urine, which is termed as human menogonadotropic hormone. Human menogonadotropic hormone. So in postmenopausal female, because of inhibition of FSH, follicular stimulating hormone, there is more amount of hormone or FSH in your bloodstream. So body will try to eliminate it through the urine. So if we will take a sample from a female who is menopausing, who release more FSH, that FSH can be extracted and that can be used medically to a patient who has infertility problem. So that can be treated by that. So it is termed as human monogonadotropic hormone, right? These are the symptoms which I have told you. Patient may have a vasomotor symptoms, that is sweating, flushing, palpitation, anxiety. This episode will be last for 1 to 3 minutes to 5 to 10 times per day. And this is mainly because of estrogen withdrawal on LH surge. LH is increasing, estrogen is reduced. So this is the reason, this is the main reason where we have to start with hormonal replacement therapy. So we'll discuss what is hormonal replacement therapy later, right? So these are the common problem which is associated with menopause. So first is vasomotor symptom, musculoskeletal system, urogenitally or urogynecological problem, Alzheimer, metabolic problems, and malignancy. So first we'll learn what is vasomotor symptoms. So as I've told you, hot flushes are very much common in this, and it may vary in frequency, intensity, and duration. At the early phase of menopause, patient may have high chances of hot flushes, and the intensity of hot flushes is very high. Over a period of time when they will be ending, not ending, when the menopause is commencing further. So the intensity and even frequency of hot flushes will be reduced. It may vary from 4 to 10 minutes to some may have 1 hour to 2 hours of hot flashes, which will involve their face and neck. And it can manifest as at a night sweat, and patient may have difficulty sleeping. Sometimes it is so severe that it will result into anxiety, irritation, and panic disorder in the female, right? When do VMS occur? So in a lifespan of 30 years of postmenopausal female, at least 10.2 years, patient may 70 to 80% females suffering from hot flushes. Some may have reduced the number, some even have more vasomotor symptom where LH surge is more, so that is more than 11 to 12 years. So that will drastically affect the quality of life of individual. This is the severity score of hot flashes. One, that is mild, moderate, severe. Mild means only there will be a feeling of hot or feeling of heat over the face without any sweating. Moderate is feeling of heat with sweating, and severe, that patient having sweating, feeling of heat along with some other neurological problems such as palpitation. They will have a disturbance in their normal ADL activity, even disturbance in the sleep, right? So these are the hot flushes which may continue after the year of menopause, and after 60, that has been totally stopped, right? So these are the problems. So that is about vasomotor symptoms. Second is change in the body, reproductive organs. So vagina, as we have discussed, there will be increase the vaginal pH level, right? So from acidic, it become normal, or it become basic or alkaline. So pH will be changed. Vascularity will be changed. Thinning will be there. There is a loss of Raj. Raj is in vagina, right? So for example, this is your vagina. So in vagina, there are small ring formation, right? That is responsible for dilatation and contraction of the cervix during the sexual activity and during even a childbirth. Because of age, senile degeneration, or lack of estrogen level, these rugs are depleted, they are collapsed. So there won't be a proper patency of vagina, which will lead to either prolapse of the vagina or either repeated infection or even sometimes dyspareunia, that is difficulty in sexual intercourse or sexual activity, right? If we are talking about cervix, so cervix become flushed with vaginal fornix. There will be thin endometrium, uterus become very small. There may be a fibroid formation. Pelvic ligament become very weak, which will lead to pelvic organ problems, right? Second, and another important thing is psychological symptoms. Because see, estrogen have a drastic role not only in reproductive activity, but it is a good mood elevator also. It will normalize your sleep pattern. It will release your melatonin level, right? Dopamine level. So in absence of estrogen level, there will be mood swing, irritability, poor memory, loss of concentration, low self-esteem. Musculoskeletal, maybe it is related to degeneration, senile degeneration, along with that osteopenia and osteoporosis. Many of patients have backache and joint pain. Sleep, if we are talking about general population, 14% of general population is affected by sleep disturbance. But if we are talking about only postmenopausal women, it accounts 40%, right? Out of that 100, 40% female have sleep disturbance, either because of hot flashes or because of psychological problem and other problems. It can be associated with hot flashes, anxiety, depression, same time fibromyalgia and obstructive sleep apnea. As we have disturbed, sleep disorders are there. It is not like that a person is normal and then after achievement of, after entering to menopause, sudden they have sleep disturbance. It is not like that. Maybe sleep disturbance are there since many a time, since a long way, but menopause will aggravate the sleep disorder, which may also include restless leg syndrome, persistent movement disorder, and a problem with their co-partners, right? Another condition which is associated with age along with menopause will aggravate it is obesity, sleep apnea, GERD, incontinence, nocturia, thyroid dysfunction, chronic pain syndromes, and fibromyalgia. Right. Another genitourinary functions include urethral syndrome, where female have increasing frequency. Either they have to go for more frequent urination. Normal frequency of urination is 4 to 5 times a day and maximal 2 times a night. But in this female, right, they may have an urgency, frequency, dysuria, that is painful urination, and recurrent UTI. Right? There will be a vaginal dryness and dyspareunia, and patient may have loss of libido. Sexual problem, which we have already discussed, that is dyspareunia, which will lead to sexual dysfunction, and patient have sexual desire disorder. As I've told you, there is no need to go for particular diagnosis retrospectively. It is a retrospective diagnostic, but there is a objective criteria, that is 12 months of MNA. Lekin in certain condition, you have to go for certain hormonal profile to rule out whether there are the chances of fibroid formation, whether there are the chances of endometriosis or not, right? So first of all, for diagnosis, history is okay. Sometimes what they will do, they will take a pap smear test. We'll discuss pap smear in later, okay? Where they will take a sample from the cervix. They will take a sample, a small amount of cells with spatula, and then they will analyze for their cytology or histology, right? And they will also check for pH. So postmenopausal pH, the pH level is more than 4.5 to 5. So that is suggestive of neutral pH or either what we say is alkaline pH, right? So the one thing is history examination and objective criteria. Second is pH testing and cytology of the cells around the vagina. For hormonal profile, what will happen? Your FSH level. Now, for this, you have to understand the normal physiology. The first time when a female becomes, a girl have a menstruation period, that is menarche. Menarche, when it will happen. So, after a certain age of the living of a girl, say for example, from birth to the 10-year or 12-year, their hypothalamus will sensitize it. Their hypothalamus will release gonadotropic releasing hormone. This gonadotropic releasing hormone will give a command to the pituitary gland, which will release follicle stimulating hormone. That the name suggests, follicle stimulating hormone. So this hormone will, what we say, stimulating the formation of the follicles from a small oocyte, which is stored in your ovaries. Okay. Once now, what will happen? Out of 10 to 12 follicles, one is mature and then it is ovulating. Okay. So now estrogen had done its role, right? Now this estrogen will give a negative feedback to your pituitary gland, stop releasing follicle stimulating hormone, because ovulation has been done. The number of these cells has been already maturation. So there is no need for more estrogen. Okay, so the FSH value is optimal. Say, for example, it is 10 milli international unit per minute, right? But in menopause, what will happen? Because your ovarian function is declined, right? There is no inhibition. There is no negative feedback from the estrogen to your pituitary gland. So pituitary gland will release FSH. So there will be a higher amount of SHS, and that will lead to infertility and other issues like vasomotor symptoms, right? So if your estrogen is less, that is one thing that will diagnose your menopause. Second, if your FSH value is more, if your anti-Mullerian hormone and inhibin B level is low, right? When a female is in a fertile phase, the more number of Graafian follicle, as the more number of mature Graafian follicle, there will release anti-Mullerian hormone. But whenever there is low storage, low reserve from the ovaries, what will happen? Your anti-Mullerian hormone will be reduced. Okay. So for menopause to diagnose, anti-Mullerian hormone is low, FSH is increased, and estradiol is increased. Same way in transvaginal sonography, which is done in third day of menstruation cycle, suggestive of low antral follicular count. Okay. So this can be the diagnosis for this, which we have already discussed. Along with that, certain symptoms, sign and symptoms. Along with that, you have to go for certain another investigations such as CBC count, urine investigation, fasting blood sugar level, lipid profile, thyroid hormone, stool for the occult blood, pap smear, and mammograph and other things, right? That we will discuss later. Now, when this is all about menopause, so now what is the treatment? Because we are more focused here to learn what is the treatment and what is the role as a physiotherapist in premenopausal and postmenopausal female. So window of opportunity is only not after menopause and commencement of menopause, even in premenopause, because at the age between 45 to 50 years, female may have vasomotor symptoms which is developing. They are not aware. But when it will be intensified after the menopause, then and then we come to know that this is because of menopause. So vasomotor symptoms, sleep disorder, and mood change can be that which can be detected early in form of clinical examination or history taking. And then you can design a protocol accordingly. Same way between 50 to 60 years, there are highest chances of vaginal atrophy, dyspareunia, and skin atrophy. And ultimately, once your menopause has been occurred, after that 6 year, 10-year of window, that will be a development of certain fatal disorder, which is osteoporosis, atherosclerosis, coronary artery disease, or CVD. See, as a physiotherapist, we came across with many of female, irrespective whether there is cardio patient, neuro patient, ortho patient, anything. But mind well, we have to give certain advice. But as we say, early detection will prevent the disease. It will improve the quality of life of the patient. So after age of 40, my recommendation, or the IMC, that is Indian Menopausal Society, have given certain guidelines. Okay. What investigation we should do? So commonly we prescribe them. You have to go for mammogram. You have to go for a cervix pap smear test. But not only that, many things can be checked before menopause, and we can prevent many diseases even before development of that particular disease. So one is mammography. So mammography can be done after age of 40 years, and it will be repeated once or twice a year. There are highest chances of colorectal cancer in a female. So how to diagnose it, right? So colorectal cancer can be detected by the fecal occult blood, right? So stool examination is there when if individual stool examination will be taken, and that will be cytologically examined in the microscope. If there will be the occult one blitz, that blood, okay, then that is suggestive of chances of colorectal cancer. So then they will send for the another investigation, which is termed a stool-based DNA fit profile. That will suggest or that will check the DNA and RNA property of that particular cell which is secreted in stool, right? If it is positive, then again next step is either you have to go for colonoscopy or coloscopy, right? So once your occult blood, stool-based fecal occult blood is positive, then you have to go for the next one. If it is not that, so simply every 2 or 3 years you have to go for viscous blood analysis, right? Okay. Next is HPV. हम लोग बोलते हैं commonly that after 45 years the chances of cervical cancer are more. It is not like that. After age of 30 years, because see, HPV virus is human papilloma virus. That is a virus which is usually spread through sexual contact where a female is sexually active. So that age is not only after 45, that is comes early. So now guideline has been suggest that after age of 30 years to 65 years, every 3 years you have to repeat what we say pap smear test. Now what is pap smear test? 2 tests can be checked for the cervical cancer. One is pap smear test and second is HPV test. Both are different. Pap smear means you have to take a sample of the cell from the posterior wall of the vagina, not vagina, cervix, and then it will be microscopically examined. HPV virus is special detection of the bacteria in that particular cell. So if you are going for pap smear test, it can be for every 3 years. And if it is HPV virus test, then it is 5 years, every 5 years. And some may also suggest who is having highest BRCA1-2 positive, right? Or stage is more, or the population which is more vulnerable to develop cancer. So for that particular co-testing will be that is more tests be done at the same time. That is pap smear test along with the HPV test. Okay. Along those female who has having a no risk factor related to coronary heart disease, that is no diabetes, no hypertension. So cholesterol screening can be done after age of 45 years every year. And those who is having risk factor like genetic predisposition, pregnancy complication, anything. So in that female, even early, that is at age of 20, you have to start with cholesterol screening, right? Another examination such as dental examination. So after 40 years, once a week or twice a week, it is advisable. If a person having again multiple risk factor in their families and having obesity and another problem like PCOS, then diabetes screening should be as early as possible. That is more than after the age of 35. Same way, eye examination every 2 to 5 years, 2 to 4 years after 54 years, and menopausal, that is osteoporosis screening, that should be after in 15 to 64. So now these are the guidelines which is mainly given by the different gynecologists to detect what is it, not to detect, to prevent it, right? So early detection will be there are less chances of development of the complications, right? Certain common vaccinations are scheduled for postmenopausal female that should be taken by there to have a protection against it. So flu shot, every female can get every year once a year. You have to go for flu shot. COVID, according to your predisposing factor or whether you are having COVID, you have not taken. So according to that, your doctor will suggest. Second is Tdap vaccination. That is tetanus, diphtheria, and pertussis. If you have not received, usually we have received in our adolescent, but you have not received, then you have to take is that is Tdap. Even Tdap vaccination in May, TD, that is available every 5 to 7 years. So you can go for that. Then varicella vaccine, especially those who are born after year of 90 to 80s, 1980s, right? So whose age is now starting from 45 years से ज़्यादा है, उससे कम लोग हैं, ठीक है? They can go for varicella vaccine, 2 doses of that. Hepatitis B vaccination, that can receive 2, 3, and 4 doses, but it should be before 59 year, less than 59 year. After 59 year, it is not useful, right? And herpes zoster vaccine, that is 2 doses at or after the age of 50, and which already we have discussed, that is HPV virus. HPV vaccination can be done after age of 30 to 45 years. Previously, there is a very less window for the HPV, or there has been no any evidences for the HPV can be taken after the age of 30. But now, starting from 20 years to 45 years, we can take the human HPV vaccination, so that will prevent the cervical cancer. Now, this is all about the medical aspect, general advice, or what we say is vaccination protocol. Now it comes to us. What is the evaluation procedure? So first of all, we have to evaluate the need of female. Why they are coming to us? We have to take a detailed history and risk factor, right? History related to that, I will just quickly say that symptoms of menopause, risk factor stratification, what is the current level of diet and nutrition of person, assessment of physical activity and physical functional level, sexual history, whether they are taking any drug, whether they are doing smoking or not, that all we have to take care. And special important is a psychological aspect, right? So that's much of history we have to take. General and objective examination is a measurement of the normal vitals parameter that includes your heart rate, SpO2, blood pressure, right? Temperature of the person, right? That we have to take care of that. Again, there are the chances of central obesity after postmenopause, right? So you have to check waist and height and weight, waist circumference, waist hip ratio, BMI, breast examination, and pelvic examination. See, teach your every patient to go for breast examination because even in perimenopausal period, there are highest chances of breast cancer. Now, breast cancer is even more common in premenopausal female compared to menopausal female because estrogen has a good role in breast development. But if now this estrogen is much high in your bloodstream, that will increase meiosis of the cells, which is responsible for the cancer. So not only after age of 50, even early young female are more prone to develop breast cancer because of hyperestrogenic state, right? So these are the steps of the breast examination. There are 5 steps. First of all, see, it is a duty of female herself to know herself, right? So breast examination can be done in front of mirror or even during a shower. So one by one, they have to put their hand clockwise and anti-clockwise, right? Second, that you have to examine the breast in a mirror in front of your arm should be up, arm should be down, and arm should be up, as you can see in the figure. Third thing is they have to stand and press the breast clockwise and anti-clockwise. Okay. Fourth, this can be done even in the supine position. And fourth is you have to squeeze your nipple to check for any discharge. Now, what things you have to keep in mind? If you found any node in the breast region, if you found a painful node in your breast region, if you found there is much darkening of aurora around your nipples, right? If there will be more prominence of the nipple level along with that exudation and painful problems or painful squeeze, that is suggestive of breast cancer. That can be a sign of breast cancer. So even though you are not sure that you have this or not, but once you found that I'm having this much of problem, go to the physician or go to the gynecologist to rule out for the breast cancer, right? Certain other advanced technique can be used, that is mammography and breast ultrasound, which exactly rule out the chances of breast cancer, right? Now comes to the treatment. So main important thing is menopause is a natural process. This is a gifted by God that you have menstruating since so long. So now you take a rest. But it may have certain complications. So for that particular symptom, we have a treatment because we cannot make a person fertile again and start menstruating her, right? So our aim of treatment for postmenopausal female is to relieve her symptoms and to prevent a complication. So that can be done by lifestyle modifications such as exercise, weight loss, smoking cessation, avoiding excessive heat, spice, alcohol, pelvic floor exercise, and cognitive behavioral therapy. Now, this is our most important thing. Many patients come to us and they will say, ma'am, should I go for hormonal replacement therapy? Should I take estrogen? Should I take progesterone? What should be our reply, right? So, yes, you can go for hormonal replacement therapy, but there are chances of problems, right? In which kind of patient, in which group of postmenopausal you will go for hormonal replacement therapy? Mainly those who is having severe hot flashes, which is not treated by lifestyle modification, right? And which will affect the quality of life. That's it. Otherwise, second, to prevent osteoporosis. You rule out that a patient have chances of osteopenia now or multiple fracture. She is more vulnerable. She is more vulnerable for the osteoporosis. So to prevent that, you can definitely start with it. And third is to maintain a quality of life. But certain absolute contraindication for hormonal replacement therapy is that is ABCD. If you are having acute cirrhosis or acute liver disease, any kind of liver disease, you should not go for this. Why? Because whatever you are taking synthesis estrogen, that will go to your liver and it will drastically burden your liver and that will increase the problem related to it. So in liver disease, definitely no. Second is undiagnosed vaginal bleeding, right? So many times what will happen, we may have, this is just because of hormonal imbalance and all. So, okay, we can go for no. If your vaginal bleeding is not diagnosed and there is no exact diagnosis why there will be abnormal bleeding for vagina, then don't go for this, what we say, hormonal replacement. Third is cancer. Again, as I have told you, hyperestrogenic phase will lead to cancer of breast and uterus. because it will lead to proliferation. See, there are two main hormones in our body. One is estrogen, second is progesterone. What is the function of estrogen? Estrogen will increase the proliferation of the cell during menses cycle. Progesterone will be released when there will be a level of estrogen. After the ovulation, with luteus, corpus luteum, your progesterone level are increasing. And then after once there will be no fertilization in a one, this progesterone will be start dropping drastically, and that is responsible for menorrhagia. That is responsible for menstruation cycle. Now you are giving only estrogen, estrogen, and estrogen. There is no release of progesterone. What will happen? You will have breast cancer. You will have uterus cancer. So in both conditions, you should not go with HRT and thromboembolic event. Hyperestrogenemia can lead to early stroke and severe stroke, right? So this will estrogen, hyperestrogen level will have a thromboembolic event, right? So in this condition, you should not do. These are the benefit at certain risk and definitive risk factor for hormonal replacement therapy, where you can get benefit from hormonal replacement therapy, like in case of vertebral fracture, wrist fracture, any symptom related to menopause, especially hot flashes. Certain uncertain risk factor can be there with hormonal replacement therapy, that is dementia, right? Thromboembolic event and endometrial cancer. And what are the definitive risk factors? If you will take hormonal replacement therapy more than many years, like 2 years, 3 years, 4 years, 5 years, then definitely you are having the chances of stroke, polycystic, coronary artery disease, breast cancer, and even ovarian dysfunction, right? So this is all about this. These are just, I will give you a brief about, because many patients come across us female, especially they will say, I'm having osteoporosis. What is the role of medicine? What is the role of exercise in osteoporosis, or whether my osteoporosis will be cured by my physical activity or not? So the answer is osteoporosis cannot be reversed by physical activity, right? You have to go for certain kind of medication. Yes, like the symptoms related to osteoporosis, that is fatigue, pain, decrease in lean body mass, decrease in weight bearing capacity, that can be definitely improved by physical activity or physical exercise. So what all are the drugs which is available for osteoporosis? So first is bisphosphonate. Simple, bisphosphonate. Why there will be osteoporosis? There is increase is osteoclastic activity. So this is of exactly inhibiting whatever your estrogen is doing. What it will do? It will inhibit the osteoclastic activity, so that the chances of the osteoporosis will be reduced. Second is inhibin. Again, it will decrease the maturation of osteoclast. If there will be no maturation of osteoclast, there is no osteoclastic activity. So bisphosphonates is the first line of drug for the osteoporosis. Second, which is termed as SERM, right? So this have two effects. See, as I have told you, estrogen have positive effect in hot flashes and another things, right? But at the same time, hyperestrogenemia can lead to breast cancer. So SERM is selective estrogen reuptake modulator, where certain cell, if you will give this drug, certain cell will receive a function. Certain cells will increase the estrogen level. On the other hand, certain cells are not influenced by this synthesis estrogen level. So you will have a dual benefit, right? Certain other drugs are there, that is denosumab, that is mononuclear antibody. As you can see in a picture, there is an osteoclast, there is RS, that is ring ligand. Ring ligand is responsible for binding of ring receptor, and if it is receptor is acting, then osteoclastic activity will be facilitated. Now, if you are giving antidote of that, so your ring ligament won't work and osteogland won't be activated. So this is a management of the osteoporosis, right? This is the window opportunity. So what would be the things which we have to take care? So first is you have to eat right. What should eat by postmenopausal female? The thumb rule is you have to count a calorie to a female. You have to find out the basal metabolic rate of a person, and according to that, you have to plan a balanced diet. If you are taking 100 portion of the meal, out of that 60 account for carbohydrate, 20% calories account from the protein, and the rest of 20% calories should be given from the fat. Protein amount should be in moderation level, because you may develop, menopausal woman may develop osteoporosis. So protein intake should be there. Okay, what is a normal dosimetry? 0.8 gram per your weight. So if your weight is 60 kg, 60 into 0.8 gram, that should be your intake of your protein. Carbohydrate, if possible, take it in a complex carbohydrate level. Fat should be 20 to 25 gram, right? A low-fat plant-based diet is very much useful for this because it has been said that if you are using it, right, vegetable oils and all that, if even though you will take it at the 30 percentage from your balance diet, it is okay, but it should be unsaturated fatty acid, right? Whey protein is very much important for you. You know what is whey protein is? If we will take a whole milk and then we'll make a curd out of it, whatever the watery portion is that is termed as whey protein, which is highly rich in certain enzyme, which is responsible for the lean improvement or stimulation of the skeletal muscles or increase in your lean body mass. Okay, so whey protein is very much important. Some group recommend that even if you will take 1.2 to 1.5 gram per day per kg of your bodies, it is okay. You won't develop uric acid because it is that much of good and it will utilize for the formation of your skeletal muscle and lean body mass. Okay. Increase of protein intake is more effective when vitamin D level is at optimal rate. So make sure you don't have vitamin D deficiency because then your protein will not be absorbed, right? Micronutrient, if we are talking about, at least per day you have to take 2 to 3 serves of the fruits and vegetables. Milk and milk product, that should be 1000 to 1500 calcium per day is recommended. Again, vitamin A, D, E, K, which is fat soluble vitamin, you should take this. Now there is a good role of vitamin E in your body. Vitamin E can be obtained from the dry foods, okay, which is very much high source of the vitamin E. That will marginally improve the hot flashes in females. At least you have to give advice for this. And if you can give a capsule of this, if dietary intake is not sufficient, that is 800 to 1000 inter-unit, okay. And you can also reduce once your frequency of hot flashes are reduced, right? Omega-3 fatty acid, which is cardioprotective, especially flax seeds, walnut, canola oil, or soya beans. So, okay, so that is also good for the postmenopausal female. Phytoestrogen, which are very much important, not only for the hot flashes, but acute vaginitis, dyspareunia, and vaginal dryness. Okay. So especially bean of the soy plant is very much important. So soya bean is very much, helpful in a female or in those who is having high deficiency of estrogen. So see, if a menopausal female have certain symptoms, so we should not directly jump into the hormonal therapy. We can go for non-hormonal therapy, that is lifestyle modification, exercise, diet, and all that, right? Now, the next is isoflavones. Isoflavones are also a natural alternative to your hormone replacement therapy, which not only increase a BMD level, a bone mineral density level, and that will decrease a bone loss also. This will also improve your insulin sensitivity because after 50 years, you may have chances of development of diabetes, right? So this is also useful for that. That is isoflavone, which is readily available. You have to boost your fiber intake because laxative, it will be work as a proper laxative. It will make you a full, so you will eat a less and chances of weight gain will be less. So fiber not only improve your gastrointestinal dispersion or wastage, but it will also make you full, right? No sugar. See, even the researches says that smoking is equal to sugar, taking sugar. So sugar intake more than 10 grams per day in postmenopausal female can aggravate the hot flashes, right? So if possible, try to minimize this. And after end of 50 years of 50, at least you have to totally stop the sugars. That has been the guideline. So this is about the dash. You should not take a salt more than 1.5 teaspoon per day, right? Mind well. Oil should be 2 level, that is 2 tablespoons. Food should be 100 gram. Vegetables 300 gram. At least minimal. Water intake should be 8 glasses. You have to also add a powder. You can add a powder to your water that is contain flaxseed, cinnamon, fenugreek, soft, or in salad and curd. So that will have a good effect in your body. Now about your tea and coffee, you have to avoid taking a caffeine more than 200 mg per cup. That is related to one medium cup is around 70 to 80 mg, right? So 3 cups, not more than 3 cups of tea and coffee is recommended, right? So this is all about that. Drink in moderation. I'm not felicitating you to drink, but moderation drink is okay. But excessive drinking can again worsen the liver problem and again lead to problems, osteoporosis or not. So define it. So best define it as the level of drinking that causes at low risk of alcohol-related problem. Okay, so at least if they are taking, right, so that should be not more than 2 drinks per day. Say no to crash diet. Should not go for crash diet, because see, this is a vicious cycle. You will eat, you will lose, then your BMR will be loose. Now you are eating normal, so you will have a weight gain. So this is a vicious cycle. So once you will stop do starving, your body think that, oh, I'm not getting anything from outside, I have to store. So it will reduce the basal metabolic rate, and thereby crash diet will ended up with a weight gain after the loss of 10 kg and 15 kg also, right? This is the handy portion guideline. If you are talking about vegetable कितना खाना चाहिए? 2 हाथों में आ सके इतना. So choose as much as you can with both the hand. That should be the portion of vegetable. If we are talking about fruit, grains and milk, then make a fist. तो इसमें जितना आ सके उतना आपको खाना है. If you are taking meat and alternatives, then इतना portion आप खा सकते हो. This is recommendation. If you want to eat a cheese, not more than this. And if you want a fat and oil, itna portion, kitna aapka thumb. So this is termed as handy portion guideline for postmenopausal female. Now I have already covered all these things, so I'm not going into detail with it. I will share the screen. I will share the PPT, right? Now, certain recommendation for the calcium and another, which you should know, is at least recommended level of calcium should be more than 800 to 1200 milligram. Upper limit can be 2500 per day also. Vitamin D is very much important, right, for calcium absorption, along with another factor also. So that should be 1.5 to 2 with 1500 to 2000 international unit. Okay. Now, calcium throughout the year, what is the rate of calcium absorption, which will lead to osteoporosis? So 20 to 30%, and then it will gradually decline. So by the age of 65, your calcium absorption efficiency is typically 50% below that adolescent peak absorption. So even though you are giving a taste 3 times a day calcium, but it is not absorbed in your body. As you increasing in your age, what will happen? Your absorption capacity of calcium will be reduced. Okay, so mind well, if you are treating a 40-year girl, 40-year female for osteoporosis and 60-year female for osteoporosis, the same drug will not apply to, not given to a particular female, right? Now, these are the type of calcium supplements, right? Calcium carbonate and calcium citrate. Now, ये क्या आपको दिया है 40 and 21. These are the absorption capacity. So, if I will giving a 1 tablet of calcium carbonate, 40% will only absorb by your body. So these are the different group of calcium which is given to treat calcium deficiency. Carbonate and citrate. Commonly we are giving this, but leuconate, lactate and phosphate will have a less affinity and it will less absorb in your body. So there is no need to give. Mostly we are prescribed with calcium carbonate and calcium citrate. Okay. Now what is the difference in between that? Calcium carbonate is something which should be taken with milk, because it will have a poor absorption, and calcium citrate is good. It can be taken anytime. It will cost more, and even it will be absorbed in a female whose age is more than 50. So usually they will select calcium citrate and rather than calcium carbonate. Okay, so this is about the vitamin supplementation, calcium supplementation. Enough sun exposure should be there, even though we are living in such an area where sun is readily available any time, any month, any year, but still we are not exposed to sunlight. So ideal time for exposure to sunlight is between 11 to 2 p.m., which is preferably best. Maybe your clothing, sunscreen, your window glass pollution can reduce the synthesis of vitamin D. So there will be a full sun bath if possible with minimum clothing. Okay. Vitamin D deficient population, maybe those who are having obesity, that will go for stomach size reduction surgery, which is termed as bariatric surgery. Those who are having milk intolerance, lactose intolerance, that are the definitive population for having a vitamin D deficiency. So vitamin D should be taken precautionarily, right? If there will be a severe deficiency, what is the recommendation for vitamin D? That should be a powder. It is available in a powder. So every week you can take one pouch that is of 60,000 inter-unit per week. And that is consecutively for 1.5 months. That is your 8 weeks, 6 to 8 weeks. Even injection of vitamin D are also available, but that would be take in separation of 3 months. So if I have taken today, then after 3 months I can repeat it. Otherwise, there is no need because it is high in dose, that is 6 lakh of inter-unit, right? Maintenance therapy can be there if you find if you find there will be a deficiency, right? So this is all about the vitamin deficiency. Benefits of collagen, right? As you age increasing, collagen fiber is increasing. So that will lead to the, what we say, fragility of the bones, fragility of skin, your texture is not good, your face is having wrinkle. So collagen is very much important for you, which will improve the skin health, help to relieve a joint pain, prevent a bone loss, prevent a muscle mass. It will improve the heart health, and other heart related problems are there. So collagen supplements can be there, and it is not necessary that you have to take a synthesis collagen. Many things are available from your kitchen which will give you collagen, such as black beans, kidney beans, rajma apna sunne hoga, soya bean, which is good in collagen fiber, nuts such as pista, right? Peanut, cashew, they are very much rich in collagen supplementation. So that will maintain the fragility or maintain the skin texture of the physical thing. Physical activity and exercise, right? As I have told you, many non-hormonal therapy are available. Don't directly jump into give advice for hormonal replacement therapy. So physical activity will improve the symptoms at least, right? So it is good for prevention of the disease and treating the present symptoms. Many therapies are available. You can go for aerobic exercise, strengthening exercise, resistance exercise, flexibility exercise, balance, and you can work on a balance and posture, breathing exercise. And especially after age of 45, you have to add at least Kegel exercise for the person to decrease the chances of pelvic organ prolapse. Okay, you know what are the benefit of the different exercises, so I'm not going into detail with it. It will decrease your weight, increase BMR, increase bone mineral density, improve flexibility, improve strength, improve muscle mass, everything, right? Okay. See, what the people are, there is one quote that is the greatest mistake in treatment of disease, that physician for the physical problem and physician for the soul is different, but the person is the same, right? So we have to treat a person as a whole, not for physical factor you go to this physiotherapist, and for psychological go to psychiatry. You have to teach a person as a whole. You can counseling them, you can give certain exercise which will reduce their stress. So I'm not saying it is 100% curable, but at least you can improve their quality of life once they will get a right treatment, till the right treatment has been around. So stress reducing technique are exercise, some form of stretching, yoga, meditation, a long vacation, calling a friend, attacking on a goal for enthusiasm and focus. Slow indulging a one period, and then favorite food, spending the time with people whom you love, right? Spending the time with a family, take a break, okay? Make a schedule and watching the TV. These are the stress reducing technique, right? This is the role of exercise in menopause. Certain modalities can be used for the hot flashes. One is cooling technique, especially cooling around the face, cooling around the neck region. That will be reduce the hot flashes by 30 to 40 percentages, which is level 2, level 2 evidences. Now, what is the mechanism? Because cooling at the peripheral area somehow decrease the core temperature. Now, why hot flashes are there? There will be, why hot flashes are triggered? Because there will be rise in your core temperature. So either you can wrapping, either you can use a you can use a AC rather than using a fan or window or anything else, right? So that will reduce. So more trigger you will control, the lesser the chances of hot flashes to be evident. So cooling techniques are useful. The women have to avoid caffeine, spicy food, and alcohol, which will trigger that hot flashes. Exercise and yoga. See, many studies have been there which says exercise will improve their hot flashes, but in mild to moderate symptoms, right? Mild to moderate category, which we have seen already. But if you are having severe category of hot flashes, then you have to go for medical treatment. So exercise and yoga lead to smaller improvement and were not recommended as a single intervention for VMS. It will be combined with some medical management. But yes, obviously, the benefit from physical activity will definitely decrease the chances of complication related to menopause, right? So dietary modification, यहाँ पे only one article will be there which will focusing on soya bean, right? Intake of soya bean with a normal routine. That there is no change in the diet of female, except they will be given a certain amount of soy product in their what we say in their routine diet. And they found that after 12 weeks of the study, they found that 88% reduction in their hot flashes. So advise your patient or advise your nearer to at least have a soy product, right? Tasted aspiration. So that is a deep inspiration, deep expiration, what we are doing. That not only control the depth of respiration, that will give you the insight, that will normalize the function, that will normalize the hormonal level, and thereby it will improve the peace of mind. Yes. Metabolite sometimes used to control menopausal, and this, sorry, okay. So pollen extract can be used as a non-pharmacological agent. They are used as they're ready-made available in a market as a capsule. So you can say that ammonium succinate, lactobacillus, these are the probiotics that can be also used, right? So these are the level of evidences what I've taught you, that is lifestyle. You can go for cooling technique, avoiding trigger, exercise, yoga, diet modification, and weight loss. This is highly recommended, moderately recommended. The level of evidences are 2 to 3. What is highly recommended is body mind technology, which is cognitive behavioral therapy, hypnosis, pace respiration, and relaxation. And yes, obviously, the hormonological hormone therapy is also useful. There are, certain evidences are also available, which will say the physiotherapy modalities will improve the insomnia and depression, even in perimenopausal women, menopausal women, and postmenopausal women. So effectively exercise with a proper dosimetry and proper duration will not only improve the mental peace of the patient, but it will improve quality of life by decreasing the depression and improving the sleep cycle and treating the insomnia. So this is all about that. So in last, I would like to say menopause is inevitable. Nutrition, exercise, and medication are important and golden stage of your menopause. Lifestyle modification is important and should be considered in the treatment for the menopausal female. Adequate calcium plus vitamin D is useful for the osteoporosis prevention and prevention of fall. And physical activity can help to manage the menopausal symptom and decrease the risk of cardiovascular disease and osteoporosis. So see, don't let the age change you, change the way you age, right? So with a proper treatment, you can improve the aging process. You cannot say that I'm 45, I can't be old, right? But yes, your biological age will be definitely reduced if you are having a good lifestyle. So this is the end of my session. Thank you very much for listening me. Thank you very much.
Well, thank you, Dr. Shelja. If anybody has any questions from the audience, they can just put it in the chat box. Audience, if you have any question, please put them in the chat box so that the speaker can answer them. I hope there's no question now. So we'd like to thank you, Dr. Shelja, on behalf of the entire team. So on your enlightening webinar on Menopause, the Change Challenge. So the presentation was incredibly informative, and it has addressed the multifocal challenges which are faced by the women during menopause. You provided a really deep understanding of those all physical, emotional, psychological transitions which happen during the menopause in a female. And thank you for discussing all the practical strategies for managing those symptoms. And discussing upon all the modifications in hormonal changes, lifestyle changes, and the importance of medical intervention, and especially the food, etc., how to manage, and the dietary control should be managed. We really appreciate the time and effort you dedicated to make this session educational and engaging one. So I hope this was really quite motivational, and raised awareness and equipped everyone who attended and who will be further noticing it on our IAP channel page, and will definitely equip all with the knowledge and support of this phase, which is a very important phase of women's life, menopause. Thank you once again for sharing your expertise and insights with us, and we'll definitely look forward for more opportunities along with you. Along with this, I'd like to thank Dr. Shweta and Dr. Heta and the team media from IAP for all your support in organizing this event. Heta and Dr. Shweta, if you want to say something, please.
That's it.
Okay, then I think we can close. Thank you so much, Heta.
Thank you
Thank
very
you,
much.
IAP team, for the coordination. Thank you.
Thank you.